And here is your question. Okay. Can you hear the bell?
Yes.
Yes. All right. Now, right. So if you have read and understood, considering it surgical anatomy station, kindly please identify, if you could identify on the left-hand side image, if you could see A, and if you can
Yes.
identify 2, please.
Acromion.
Okay. If you can identify number 10 over here.
Scapular spine.
All right. Can you please tell me what is this number 5, please?
It is the infraspinatus fossa.
Okay. Can you please tell me what this gives attachment to what muscle?
To the infraspinatus muscle.
Okay. If you can identify number 11 over here.
It is subscapular fossa.
Good. Right. If you can identify number 3 here, please.
It is the coracoid process.
All right. If you can move on and identify in the same here region 8.
It is the medial border of the scapula.
Yes. What attaches here?
The teres minor and major muscle.
All right. What is the nerve supply of this muscle, please?
Teres minor muscle is supplied by the suprascapular nerve.
Yes.
And the teres major muscle is supplied by the axillary nerve.
Major or minor, which is supplied by the axillary nerve, please?
I think teres major.
Minor.
Minor, okay.
Yes. Can you, if you're looking at this small image, which is set in image here, can you tell me what is this that you're looking at?
It is a shoulder girdle.
Yes. Can you please tell me how shoulder girdle is formed?
Shoulder girdle is formed from the head of the humerus together and which is articulating with the glenoid cavity
Yes.
of the scapula. And
Yes.
there are some capsule and a few ligaments supporting this articulation.
Yes. Can you name the muscles and ligaments, the supporting structure?
Okay,
Okay,
the muscles.
girdle. Yes.
Okay, the muscle supplying is the shoulder girdle muscle, which entails subscapularis muscle, supraspinatus, infraspinatus, and teres minor muscle. And and there are also a capsule which harvesting the head together with the glenoid cavity and some ligaments such as the coracohumeral ligament and also that's why no.
Okay, can you please tell me where this shoulder joint is weak or the weakest? At what point?
It is weak from the inferior aspect of it due to deficiency of capsule and deficiency of muscles and the presence of quadrangular space.
Okay, good. If you can, right, moving on to the picture C on the right-hand side. If you can tell
Yes.
me which joint is this?
It is it is a claviculoacromial joint.
Okay. Can you please tell me what are the muscles, what are the ligaments or the structures, I can say? What are the structures which are attached over here?
I can come to this later.
All right, good. All right, okay. Can you please tell me, right, what do you understand by the term rotator cuff?
Rotator cuff muscles, they are the muscles, a group of muscles which
Yes. Yes.
supports the shoulder girdle, and also it helps in externally rotate the and helps in rotation of the shoulder joint, the shoulder at the shoulder joint.
Okay. And what are the group of muscles which are called rotator cuff muscles?
They are the supraspinatus, infraspinatus, teres minor, and subscapularis muscle.
All right. Can you please tell me the nerve supply of subscapularis muscle, please?
Upper and lower subscapular nerves.
Good. Can you tell me the origin and insertion of teres minor muscle, please?
From the medial border of the scapula, and then it inserts into the greater trochanter of the humerus.
Yes. And what is the nerve supply of teres minor?
Suprascapular nerve.
No.
Supraspinous.
Axil.
Supraspinous nerve.
Axillary. Okay.
Axillary?
Here, yes.
Okay.
Axillary nerve supplies only two muscles, deltoid and this teres minor. You have to remember that. All right. Okay, we are moving here. If you remember, which bone is this? Number one?
The humerus.
Right. On humerus, there are certain spaces. If you can tell me the boundary of quadrangular space, please.
Okay, a quadrangular space is made laterally from the humerus, and then medially from the long head of triceps, and then superiorly from the lower border of the teres minor, and inferiorly the upper border of the teres major.
What are the structures which pass through this quadrangular space?
The axillary nerve.
Which nerves? And
Axillary
which vessels? And which vessels? Circumflex?
Circumflex the humeral artery, yes.
Yes. Vessels, not just artery, vein as well. So you say it vessel. All right, good. Can you tell me what kind of image are you looking at?
It is a magnetic resonance arthrogram.
Yes. What are the conditions in which you will ask for this investigation?
In case of ligamentous injury or spinous or muscle injury.
Right. Suspicion of muscular or ligamentous injuries. Good. Can you please identify these blue circled structures, please? What is one?
This is acromion.
Yes. 4, please.
Clavicle.
5, please.
Deltoid muscle.
This blue arrow, can you please identify?
This is the glenoid cavity. This is the glenoid cavity?
Yes. Good. All right. Can you please, right. Next image. All right. That was it. All right. If you can tell me, right, what are the factors which decrease the stability? Oh, you told me this one already. All right. If you can tell me the tendon of the long head of the biceps, it lies in which groove?
Long head of triceps.
Yes. Long head of biceps.
Biceps is the intertubercular groove or the bicipital groove.
Yes. What lies medial and lateral to this?
Okay, the intertubercular groove has a lateral lip which has insertion of the pectoralis major muscle, and the floor has the insertion of the latissimus dorsi muscle, and the medial has the insertion of the pectoralis not pectoralis but teres major muscle.
Teres major, very good. Okay. Right, bell has gone. I wanted you to tell me. Okay. Very good. All right. Most of the things I think I've already covered. Yes. One quickly, the last question. If you can tell me the dermatome which is involved in the brachial plexus on the patient.
Dermatome which involves in what?
Brachial plexus.
The brachial plexus?
Yes.
Oh, yes. From C5 to T1.
Yes. Okay, good. Good. Thank you.
Thank you.